All right, welcome everyone. We will give just a few more seconds for other people to join, but hopefully you are in the right place. Today we're going to be talking a little bit more about communication sciences and disorders. And so we have a wonderful faculty member here joining us today. She's going to introduce herself and then we will go ahead and get started. But quick reminder, if you have a question, feel free to put that into the Q&A feature and we'll do our best to get those answered for you either during the presentation or towards the end. But without further ado, here we go.
Hi, everybody. It's so great to, well, I can't see you, but it's so great that you're here today. I can see that there are a number of you in our participants, and it's so great that you could take this time out on this beautiful Saturday to join me. My name is Diane Loeb, and I am the chair of the Communication Sciences and Disorders Department at Baylor University. I've been the chair for about 4 years now. Although I've been in academia for, 30 years, I was at other universities before I came to Baylor, and I just love being a bear. As you can see, I have bears all around me, and I like it that way. Let's see, what else can I tell you? I'm also a speech language pathologist. I've been a speech language pathologist for 37 years. And my area of expertise is working with clinical research and clinical interventions with children who are born preterm and children from birth to 5 years of age. So what I'd like to do today is tell you not about me so much, but to tell you about our great program. We've got a lot of exciting things happening. And so that's what I'd like to share with you for the next 15 minutes, and then we'll open it up to questions. Okay, so again, my name is Diane Loeb, and my email is at the very end of this. So if you need to contact me, please feel free to do so. Whoops, going too fast there. Okay, so for some of you who are watching and who might be interested in the field of communication sciences and disorders, you may know somebody who does have a communication disorder or swallowing disorder. I put some famous people here that have a history of or do currently have a language or a communication sciences disorder. So we see Tiger Woods there, Ulysses Grant, Barbara Walters, Amelia Earhart, James Earl Jones, Peyton Manning. So there are many, many individuals in the country that have communication disorders or swallowing disorders. And as long as I've been a speech language pathologist, there's always been a great need for speech language pathologists and audiologists. So it's not a field that's saturated. It's very much a great need for more people in the profession. And it really has been that way for probably the last 30 years, and it continues to be. In our department, we are very much a family, and we, as being Christian faculty, we very much enjoy the time to spend in fellowship together and to pray together. I have one of the things that we talk quite a bit about in our program and at Baylor, and that's being the light to the world and being Jesus's hands and feet. That's very much for us. Being a speech language pathologist or an audiologist or a deaf educator is a ministry, it's a calling, and it is it's also very challenging because as you're working with people, people have different personalities and they have different range of needs, and so it's challenging intellectually, and it's also challenging psychologically and spiritually. So I've been consistently every day of my life since I've become an SLP challenged to learn new things and to do the very best I can for the people with whom I'm working, whether that be a student or whether that be a client or another faculty member. I think what I've loved most about being a speech language pathologist is the impact that you have on the lives of others. I mean, you really can change the life. If you think about someone who's not able to communicate or not able to swallow, and for you to go and to help them and assist them with that, that is life-changing. And so to be part of that, to make a difference in the world is, again, part of our ministry and part of our calling that, as a scientist, I feel that it completes me as a spiritual being here on earth. I believe that, that's God has called me into this place at this time. I'll tell you a little bit of the details of our program right now. We have an undergraduate program in which you could earn a SLP major, speech language pathology major, or a deaf education major. We used to offer it as a concentration, but now we offer it as a major in CSD. And then we also have a new minor, which is American Sign Language. So those are some things that are happening at our undergraduate program. We do a lot of things to try to get our undergraduates to mix with our graduate students in terms of pre-COVID, we'd have social mixers, and we have a great student organization, which is called NISHLA, which is great to be involved with because you'll learn a lot of things and about the profession and about working with others. So it's really a great opportunity. Our master's program, we have a master's residential graduate program that has typically 100 students in it. And then we just launched last year an online master's graduate program, which currently has about 390 students in it. And we hope to kind of make that reduce a little bit to 250 as our average. We have a doctoral program that's just been approved last May, and we hope that we'll have between 16 to 18 people who are interested in their doctoral work. Again, in communication sciences and disorders, there's a very big lack of PhDs to take the place of our retiring PhDs. So about 25% of the positions go unfilled every year. So we really want to help meet that need here in Texas, and hope to do so through our doctoral program. So if that interests you, any of those things that I know right now you're thinking about your undergraduate work, but do take a look at our website and take a look at our graduate program and our doctoral program and what we say about that. And these are just some pictures of some of the things that audiologists or speech language pathologists might do. Again, I don't know how many parents we have with students today, but I always like to put this out there as a parent myself, in that, is there a job for my child when they finish or my student when they finish the program? And so I want to talk a little bit about that. As a speech language pathologist, you would need your master's to practice. As an audiologist, if you're interested in that area, you would need your Doctor of Audiology to practice. And then for deaf education, you can practice with your bachelor's degree. So, and I have that detailed a little bit more in this next slide coming up. But what is speech language pathologist? Let me go into that for just a minute. And we have a pretty wide scope of practice that includes swallowing and reading and any form of communication. And really our main goals are to prevent, diagnose, and treat children and adults with communication disorders. There's 51 speech language pathologists for every 100,000 residents. So you can see that there's a great shortage from that. And the mean annual salary, again, is around $80,000. And this will vary depending on where you choose to practice in terms of the demand and the cost of living. So there are some places where it's higher and some places where it's lower. A speech language pathologist does lots of different things. We work in the area and we have clinics for them. Here at Baylor, we have a language and literacy clinic. We work with individuals who have speech, voice, or fluency disorders, individuals with hearing loss or hearing disorders, and also feeding and swallowing disorders. There's lots of places for employment once an individual earns their master's in speech language pathology, including hospitals, rehab facilitations, schools, private clinics, universities, and private therapy clinics. To speak a little bit about audiology, there are three main types of clientele and types of disability that an individual who's an audiologist might work with. One is a sensory neural hearing impairment, another is conductive hearing impairment, and then the last is an auditory processing disorder. So those are all diagnosed by an audiologist. And the scope of practice includes hearing testing, hearing aid fitting, auditory training, speech reading therapy, and other specialized testing that is connected with the ear and how the ear processes information in the brain. So let's take a little bit of a deeper dive into this. So let's say you wanted to stop after earning your bachelor's of science, whether it's here at Baylor or somewhere else. There are positions open across the country for what are called speech language pathology assistants. So this is when you would work under a speech language pathologist as their assistant, and but you would not be able to develop on your own or assess on your own. So there are some limitations to being an assistant, and it's not paid as well as being a speech language pathologist. Um, Across the country, to be licensed and to practice speech language pathology, you need your master's degree. Our master's degree at Baylor is 4 semesters. It's an accelerated program. At other programs, it's typically 5 to 6 semesters. If you wanted to, if you're really interested in the ear and how that works, and you want to be an audiologist, then that's typically your undergraduate plus a year, no, I'm sorry, it's your undergraduate degree, and then to your Doctor of Audiology degree, which is 3 years of study and 1 year of, I believe it's residency or practice. So it's another 4 years after your bachelor's. And for a PhD, you can start with a bachelor's or a master's and add 4 years to that, around 4 years. And that would typically help you become or lead to you becoming proficient in one specific area of research and teaching. Okay, I want to talk a little bit about deaf education right now. Again, we have the deaf education major, and it prepares students to become classroom teachers for working with the deaf and hard of hearing children, and it prepares students for state certification. So we work with the School of Education for those of our students who want to pursue deaf education. Careers include teaching deaf and hard of hearing children in a K through 12 setting, working in an early childhood program, and with additional certification, possibly teaching ASL at the high school level. I don't know, I bet you some of you have already had American Sign Language, perhaps in high school, but for those of you who are not familiar with American Sign Language, it is a visual gesture, multi-layered language with its own syntax and grammar. Sometimes there's this misperception that it's just a combination of gestures, but it's a true language, and it's associated with the culture of the deaf. And in other countries, so for example, there's a British Sign Language, there's a Nicaraguan sign language, and there are other countries that have their own version of sign language, whereas we here learn American Sign Language. You can take, as a student on our undergraduate program, you can take ASL, American Sign Language, to fulfill your language requirement. If your major falls under a Robbins College, which is where we are, social work, nursing, business, or linguistics. So I've been here 4 years, and I've been just so blessed to work with the amazing faculty and amazing students. And we had a donor come along beside us before I got here, an anonymous donor who provided $10 million for us to have our whole program be renovated. So we have new clinic space, new space for our students, and new space for our professors and new research labs. So, and part of that has been to increase our graduate program so we can take more of our own undergraduate students. That's very important to us. And increase our service to the community through our speech, language, and hearing clinic. We've added some new clinics. We now have a concussion management clinic, and we also have are expanding our autism spectrum disorder clinic. We have new technology that we've added. We have an eye tracking device, and we're working toward we're moving toward using virtual reality in therapy, which is one of the most cutting edge types of therapies that are being provided nowadays. In ASL, American Sign Language, they have a club. That's actually a group of their club members right in that picture there that you're seeing. And again, we have new research labs. We've hired probably 5 new researchers over the past 4 years, and are very excited about the work that they're doing in a wide range of areas of communication sciences and disorders. We also have just started providing online ASL classes. So they're going to be some offered this summer as well. And that's another new thing that we've just started doing. And then finally, it's important to our program for us to serve, as I said, to serve others. So we are working on having more study abroad and more mission trips. But pre-COVID, we were going to Kenya and Ecuador, and then we have a study abroad with Australia. And our goal is to increase this one mission trip and one study abroad a year until we really have a very nice menu of possibilities for our students. We feel that if you're able to study abroad, it just or participate in a mission trip, it can just deepen your understanding of the world and individuals in the world so much more. We are currently, again, this is probably happening in the last month, we've been given the go-ahead to work with public health, the Department of Public Health here at Baylor, and we are working with African New Life Ministries and providing speech, language, and hearing services to the children in early childhood programs in Rwanda. So very, very excited about that, and having faculty and students go for a semester on end. Probably will have that up and going within 2 years, we hope. So very, very exciting time for that, I think. And then lastly, I guess not lastly, but importantly, I wanted to say to you that each semester, we graduate students 3 times, December, May, and August. And we have, and the faculty member chooses a scripture each year. And one of our faculty members from last year, she chose Isaiah 41:10. And I wanted to share that with you today, because I know you have a lot of changes. I'm speaking to the students now, and even the parents, you have a lot of changes that will be happening soon, and they're exciting changes, and they're going to present their own challenges too in this challenging time. And I just want to leave you with Isaiah 41:10, that God tells us to fear not, for he is with us. Be not be dismayed. He is our God. He will strengthen us and he will help us and uphold us with his righteous right hand. And time again, since I've been here at Baylor, I've seen this play out. And we are a type of faculty that has open doors, and we welcome our students to visit with us, and we also welcome them to pray with us too. And we're constantly praying over you in terms of when we start our meetings and when we are discussing students. We take a very serious, we have a very serious commitment to our students, and of course to our God, and wanting to provide the best care for our students. So that's it for my presentation. I thank you. This is my information here. Please feel free to, it's better to email me than to call me right now during the pandemic. But please feel free to reach out to me, and I'm happy to answer any questions if you have any.
Looks like we have a couple in the Q&A feature. So if you can see that, feel free to answer some of those, or I can read them to you. It's totally up to you.
I can go ahead and read them. I think I got them. So is the first one you see from Lexi?
Yes.
Okay, so Lexi asks, how big is the communication disorders department? Well, gosh, we went from probably 4 years ago, and now we're at 390. We have 300 in our undergraduate program, 390 in our online masters, 100 in our graduate residential, so let's see, 490, 790. And right now, so far, we have 1 in our PhD program. We just opened up admissions. So I hope that answers your question, Lexi. Let's see. I'm going to answer a question from Megan. If I wanted to major in communication disorders to become an SLP, but wanted to minor in something else, is this a degree that you can manage while? Actually, it is. We just modified and moved from a BA to a BS, a Bachelor of Science. And as a result of that, our department could modify the electives, and we have a large range of flexibility in electives for our students to do minors. So unlike other programs where you might have might have to take, let's say you have 50 credits of elective, and 48 of them you have to be in your major. You have a lot more flexibility, and I haven't actually figured it out, but I'm very confident that you could do a minor. Let's see, Lexi. Is the mission trip opportunity related to SLP work or just general? It's related to SLP work. So our trip to Kenya these past few years, pre-COVID, we've worked with an orphanage there, and also with teachers at a school that works with children with special needs. And so we help teach the parents strategies or techniques, and also work with the teachers in that regard. In Rwanda, we're adding the hearing component as well, and so we're trying to help the children and the families to get started very early on the right track, so that in terms of exposure to language and being able to, have acoustically their classrooms be wired or situated so that they can hear accurately, and therefore learn better. So, and that's also going to be that's an undergraduate student activity that's more targeted towards speech language pathology. The trip to Ecuador, Dr. Louis Lummer, he led that a few years ago, and that was working with the deaf people of Ecuador. And so he took some students with him there to help serve them. And I think that's all I can say about that right now. I want to do SLP with special needs. Can I do that specifically? That's a great question, Addison. So I was going to say, well, so you mean children, but that's not true, is it? Because a person who is an individual who has special needs as a child oftentimes go on as an adult to have those needs as well. So yeah, absolutely. I will say our undergraduate program focuses on typical processes or foundational knowledge, and most of your clinical work, if not all of it, will be done at the master's level. And that's consistent across many programs in the country, but not all. Some programs, undergraduates are able to do more clinical work. And here we do not have our undergraduate students enrolled in clinic, except for if they apply to be part of our reading, language, and literacy clinic. Okay, let's see. Courtney, what would you say is the best way to prepare for a career in speech language pathology while still in high school? Boy, that's a great question, Courtney. I'm gonna have to think about that for a sec. I was in psychology first, and then neuroscience, and found my way to speech language pathology. So I think that the more you know about the brain, the better off you are. So neuroscience, definitely. If you have an opportunity to take any courses in that area. If you have a chance to take ASL, I think that's great too. I think I've seen, if you've had a chance to do mission trips or to work with or shadow a speech language pathologist, that's great too. I found speech language pathologists are really welcoming, and if they're able to, they will let you follow them or shadow them to see what it's like. Let's see. Other things I do in high school. I think that those would be the main things that I'd focus on. Or reach out and see who your SLP is in your high school, and see if maybe they could talk to you about their career and their choices and why they've done what they've done. That'd be kind of a nice thing to know too. Okay, Shelley, do you have to apply for the senior years for BS and communication disorders? No, you do not have to apply to get into our program, but you need to be successful in our program. So the first 4 classes that you take, starting from a freshman, it's usually freshman and June and sophomore if you started out with this major. The first 4 classes you have to earn a B or better in order to stay in the major. So that's I guess that's our if we had to have a gate, that's our gate. Let's see, Megan, how have you seen being an SLP grow your faith, and how do you balance family life well-being? Oh gosh, this is a great question. Gosh, I could spend an hour talking about that, Megan. Let's take the first one first. How have I seen being an SLP grow my faith? I think that for the families and the young children with whom I work with, so oftentimes there's fear of what's the future hold. There's that uncertainty and fear, and they didn't plan on this happening, on their child having a difficulty learning how to talk or eat or swallow, those types of things, or hear. This isn't part of what they envisioned what their life would be like. So it allows me to offer hope to families. I remember working with a parent a couple of years ago when we were doing a diagnostic, and the little boy was showing some signs of autism spectrum disorders. And so the mother really, you could tell she was very nervous. It's the first time this child's been seen. He was 3 years old, but she knew there were things that he could use some help with. And so she was very worried. And, at one point she broke down in tears and she just said, well, um, uh, will you be able to, cure him or something like that? Well, of course, I can't promise I can cure anybody, right? So I said, well, I can't promise I can cure him, but you have done the right thing. You have brought him in here now while he's so young, and we have the ability to help him um, and to get him to do more of the things that we'd expect him to be doing at his age. And so supporting the parents and giving them hope, that's something that I think is a very special gift that God gives us to give to one another. Let's see, other ways, I guess just watching children that I worked with and even students that I worked with grow in their abilities to do things. And when you see a child who maybe stopped talking because nobody understood them, and then when they're more understandable, they're talking again, it it gives that helps to bring the joy back into their lives. And there's so much of this world, and being in the world can take your joy away. So I just think that's really amazing to be able to be part of the joy and the hope of someone's lives, because a lot of times, the world just will not give you that. And if anything, you get the opposite. You just get bad news, and it's like, well, you'll have to deal with it. Gosh, since I've been at Baylor too, let me go balance a family life. But I would say that since I've been at Baylor, I've been able to grow even more in my faith, which I love because I can keep my Jesus Calling book out on my desk. And if a student wants to pray, I can pray with them. And I just, you can check your ego at the door when you're doing everything for the glory of God, right? It's when we start getting our egos involved with things that things get more worldly and more difficult to do. So I love being at Baylor for that very reason.